quarantine rubbing shoulders with some of the leading scientists and researchers in the world of palm oil. I'm here to further investigate red fruit palm oil's near miraculous health benefits and ingredients. With me is Dr. Shannon Sen, an authority on tocotrienols, a super powerful form of vitamin E. He's from Ohio State University, and I just heard Dr. Sen give incredible lectures on tocotrienols and stroke. As all you know, in North America, we face epidemic rates of cancer, obesity, heart disease, and stroke. It's our habit to typically wait for these diseases to occur before we act on them with the latest drug therapy intervention. But what if I told you that red fruit palm oil may be one of the most preventive medicines on the market today, which targets all of these diseases? So my question to you, Dr. Sen, it's a real pleasure to meet with you. How can we use the virtues of tocotrienols from red fruit palm oil to act on the brain and help the brain prevent this?
The results during the last decade are very encouraging. The first series of results now point to 5 forms of potent immunotherapeutic mechanisms. So that was the first one. Then we found that actually after you have stroke, that arteriogenic mechanisms try to help rescue the stroke affected part of the brain. And now the most recent findings are showing anti-thrombotic functions of tocotrienol, meaning that it would have aspirin-like functions in preventing blood clots.
So we're talking about the pigments in here, what makes this nice and red, the carotenoids, as well as the tocotrienols, which you can't see in pigment form, are actually protecting the brain, protecting from disease, things like Alzheimer's disease, and helping to prevent all kinds of neurodegeneration, as you put it. This is having a drug-like effect.
This is having a drug-like effect experimentally, and looks like today you heard results coming out from Malaysian University showing that in age-related lesions of the brain in humans, that the number of lesions and the volume of lesions substantially go down. That's very encouraging. Our own clinical trial is currently in progress, and we'll have to wait and see what the results show.
So brain protection, stroke, what else is this doing for our bodies, head to toe?
Our own research primarily focuses on the protection that immediately leads into our system, but if you look at other people's data, as we saw today, it improved lipid profile, it takes down cholesterol in particular cases, although there have been conflicting results, and that has been currently resolved. And also it has anti-scarring effects, it seems. So I think that as we go forward, we will continue to see more and more new findings.
That sounds really promising, Dr. Sen. So is there any reason why anyone in North America wouldn't want to be supplementing or taking this drug-like natural medicine?
So at this time, of course, anything that is potent in any given direction, there is also concern as to whether it might have any toxic effects. We have now studied well over 100, I would say close to 200 human subjects, including patients, and have not seen any adverse effects so far. So that part is encouraging. But I think I will be cautiously optimistic that it will show more and more useful findings, and finally the test is a successful clinical trial, which are currently in progress.
And where do we take research from here?
I think critically, we were mostly on the experimental phase, cell culture phase, then we moved to small animals, which were very encouraging, then we moved to large animals that seemed to have more translational value, which were again found to be encouraging. And then small human clinical trials have started. Phase 1 has been completed, phase 2 currently ongoing, and this should be followed by a phase 3 and then another children trial. I think these will be the steps that will take us to a more evidence-based medicine. Of course, the issue lies also whether it should be in the dietary supplement category, or should this go down the drug path, which are two different regulatory environments. We'll have to wait and see what is best for this particular solution.
But it all is so exciting, and it's been a real pleasure to hear you lecture, Dr. Sen. Dr. Sen from Ohio State University. I can't wait to hear you for the rest of this series. It's been real fun.
Thank you
for all the research that you do.
Thank you.